SSRIs, or selective serotonin reuptake inhibitors, is an important class of drug and considered as first line for majority of the patient with depression. Among this class, fluoxetine is the preferred one. If patient is in a state of post-myocardial infarction and suffering with depression, we give sertraline. Among children and adolescents, fluoxetine is a favored drug. Citalopram, on the other hand, is not given in patients with heart condition, especially with QT prolongation. Coming to the adverse effects, the most common adverse effect with SSRI is gastrointestinal. There is an increased risk of GI bleed in patients taking SSRI, for which a proton pump inhibitor should be prescribed if a patient is also taking NSAIDs. Patients should be counseled about anxiety and agitation, especially during the initial phase. Fluoxetine and paroxetine have higher propensity for drug interactions. There are certain drug interactions that have to be kept in mind before prescribing SSRI. For example, if patient is on NSAIDs, it decreases the risk of GI bleed, so before giving SSRI, we have to prescribe a proton pump inhibitor. If patient is taking warfarin, heparin, or aspirin, the NICE guidelines recommend avoiding SSRI and considering mirtazapine. If patient is on triptan or monoamine oxidase inhibitors, then prescribing SSRIs increases the risk of serotonin syndrome. SSRIs like citalopram or escitalopram are also associated with dose-dependent QT prolongation, so should be avoided with patient having congenital long QT syndrome or pre-existing QT interval prolongation. Following the initiation of antidepressant therapy, all patients should be reviewed within 2 to 3 weeks. If the patient is less than 30 years of age, then he should be reviewed after 1 week, as SSRI may increase the risk of suicide. Duration of antidepressant therapy should not be less than 6 months, even if the patient are making good response, as this reduces the risk of relapse. When stopping the SSRI, the dose should be gradually reduced over a 4-week period to prevent discontinuation symptoms. Discontinuation symptoms are important. Patient comes with increased mood change, restlessness, difficulty in sleeping, unsteadiness, and sweating, along with paresthesia. GI symptoms such as diarrhea is the most importantly seen in discontinuation syndrome. SSRIs during pregnancy. BNF says to weigh up benefits and risk when deciding whether to use in pregnancy or not. Use during the first trimester may increase the risk of congenital heart defects. Use during the third trimester can result in persistent pulmonary hypertension of the newborn. Among all the SSRIs, paroxetine has increased risk of congenital malformation, particularly in the first trimester.